The scapula is an interesting area to palpate. There are lots of things that are going on. There are lots of muscles that have their origin or insertion into the scapular region. The scapula is very, very important for control of the shoulder. And so this is a good area to learn how to palpate in. Plus we also have the rotator cuff muscles that are mainly in this region. When it comes to muscles in the scapular region, a couple that we can look at are both the supraspinatus and infraspinatus. So the supraspinatus sits in the supraspinatus fossa, located above the spine of the scapula, which we've palpated and located already. This is a muscle belly. So we're going to be using flat finger approach, slow and smooth, going across the belly of the muscle. And we can definitely find it as it sits down in that supraspinatus fossa up and through there. The infraspinatus is going to be below the spine of the scapula, and it's a large triangle muscle that originates this medial aspect of the scapula and comes up and inserts into the humerus. And so again, I want to palpate across. This is the direction of the muscle fibers, like this. So I want to palpate across the direction of the muscle fibers. I don't want to go straight superior, inferior. I don't want to go medial and lateral. I want to go across the fibers and be perpendicular to them to be able to palpate the infraspinatus. And being able to palpate these muscles and in this area, again, we can have the infraspinatus tendinitis, which is an issue if there's a rotator cuff issue, but also if people are having neck and shoulder issues, this is often a muscle that we may dry needle. So I need to be able to find this appropriately and make sure that I am over the scapula, because I don't want to be needling and going deep into this area, because you've got your lungs that are located right underneath the ribs there, and there is that potential of causing a pneumothorax. So we need to make sure that we're palpating in the proper area. If we're going to palpate the deltoid, remember with muscle bellies, we're going to use a slower. We don't have to go hard and fast like we do with bony prominences. We're going to be doing a slower palpation and perpendicular to the muscle. And to be able to palpate this muscle belly and find its edges a little bit better, for the deltoid, we know that it is an abductor, so I can ask my patient to abduct and resist, and the very nice outline of the deltoid shows up here, and I can ask my patient then to relax. So then I can palpate across that muscle belly. If I want to isolate the anterior aspect of the deltoid, I can then ask my patient, put them in abduction and ask her to push into my hand here and move anterior, and you can see where the anterior fibers are now under tension and will raise up, and then I can palpate those. And I can do the same for the posterior fibers, have her abducted, ask her to push back, and the posterior fibers of the deltoid are going to snap out. So remember, the best way to make a muscle to palpate is to ask it to contract. And so this is why anatomy is important, and knowing what motions your muscles cause. For muscle bellies, we can palpate the Erector Spinae muscles. So these are typically the group which there's actually individual muscles that are located all up and down the spine. You're probably going through this in anatomy right now, or have been through it in anatomy, but collectively it's just referred to as the Erector Spinae group, because sometimes it's difficult to definitely palpate and differentiate those muscles. And so for muscle bellies, again, we're going to go perpendicular, and these are nice thick muscle bellies here. And so I can just palpate across the Erector Spinae group in that perpendicular position. And I want to do this and move up and down the spine as well. And again, we're looking for maybe some areas of tightness, maybe some trigger points, or the other thing that we're looking for is when the patient says, ow, that bothers me right there, when you palpate in that area. So we're using our muscle belly technique with the flat edge of the fingers going perpendicular across the muscle. When palpating the edges of muscles, one of the easiest ways to get to the edge of the muscle is to put that muscle under tension and ask it to contract, and then move along the muscle belly until you find that edge. So for the Sartorius, we found this when looking for the femoral artery, and we know the Sartorius is the talar muscle. It flexes the hip, abducts the knee, and externally rotates the hip as well. So I can really resist any of these motions. I can have the patient try to push their knee into my hand here. I can also put it more in this direction so that now I'm also resisting some hip flexion, and say try to push up into my hand. And here is where that Sartorius, you can see that it popped up as well as some of her other muscles, but we're going to come along that muscle belly. We're not going to be lateral out here. We're going to come around that muscle belly until we find that drop off. And there's that medial edge of the Sartorius right in here as it goes down and inserts on that medial aspect of the tibia. So the semispinalis capitis is another muscle that we can find the edges of and palpate fairly easily. And the semispinalis capitis is actually part of a group of the semispinalis muscles that kind of form one large muscle group together. But so it's a muscle that originates from the upper 6 and 7 transverse processes of the thoracic spine as well as the lower cervical spine, runs superiorly, and then it will insert between the superior and inferior nuchal line. And this, again, is an important muscle when dealing with people that have cervical pain and other cervical issues, to be able to palpate this muscle and discern it out between the other groups of muscles. So its action is it extends, side bends, and rotates to the same side. So if I want to make this muscle pop out, and I can do this in a supine position as well, but I'm doing it in sitting for demonstration purposes. So I'm going to have the patient slightly extend and rotate and side bend, and I'm going to resist that, so push into my hand, put my hand there, and very nicely the medial border of the semispinalis capitis very nicely pops up out of my finger here. So there's a little bit, relax for a second, there's a little bit of an area here as we come down from the occiput and the occipital protuberance down to the spinous process of C2. And right there is that medial border of the semispinalis capitis. If I go in this position again and have her resist, push into my hand, I can also palpate the lateral aspect. I can also palpate the lateral aspect in this area here by resisting that motion. The medial side then is going to be along in through here, and here's my lateral, relax. So you can see that this is a fairly wide muscle, and it helps with cervical extension, but this muscle can get tight in a forward head posture, and so can also cause some issues because you've got the occipital nerve that runs up in through here, and that can be causing some problems with headaches and other issues in the cervical spine. And to palpate the edge of the sternocleidomastoid muscle, remember we want to put it on tension. So the sternocleidomastoid muscle is going to flex the head. It's going to laterally flex to the same side, but rotate to the opposite side. So I'm going to kind of resist, put my patient in that position, and then I'm going to ask her to lift her head up. And you can see here now the sternocleidomastoid will pop out very nicely, and you can very easily palpate the edge of that muscle, both the anterior and the posterior aspects of the muscle. And relax. And this is an important muscle. Again, it has a lot to do, it gets overworked a lot of times, so you can find trigger points in through this muscle. A lot of therapists may end up dry needling this muscle if they've got problems with headaches or other cervical pain. So it's important to know how to find and define the edge of that muscle.